All right, hello everyone. My name is Julian James-Burke, and I'm going to talk to you about the Grady North Fulton Health Center in Atlanta, Georgia. It does give you an overview of the population health metrics in Metro Atlanta. So right now, there's an estimated 5.8 million people that live in the Atlanta, Sandy Springs, Roswell, Georgia area. And Metro Atlanta is about 48% white, 33% Black, 11% Hispanic, and 6% Asian. However, this clinic is located in Sandy Springs, and Sandy Springs, the demographics is 66% white, 21% Black, 13% Hispanic, and about 6% Asian. And despite Atlanta being such a hub for public health, with the CDC being here and with multiple large hospitals here, they still have some major issues on their hands, like cardiovascular disease and sexually transmitted infections. In fact, Metro Atlanta ranks in the top 5 in the nation for STD prevalence, and these include diseases such as HIV, gonorrhea, syphilis, and chlamydia. And just to give you some statistics, there's about 614 cases of chlamydia per 100,000 people, and 201 cases of gonorrhea per 100,000 people. The numbers are quite staggering. And just to give you a visual of where the North Fulton Health Center is, it's actually right off the main road, Roswell Road, which is the main artery of Sandy Springs, and this is actually the heart of the neighborhood. And just south, there's a Publix where people get all their groceries, and a Walgreens where people can get medicine if they have a cold, or they can go to the Walgreens pharmacy if they can't drive 25 miles in the city to the main Grady outpatient pharmacy. And the further south you go in Sandy Springs, you start getting closer to the city of Atlanta. And once you get closer to the city, you start running into things such as Trader Joe's, Whole Foods, Rumi's, which is a very popular restaurant, and other fast food chains as well. So there's a little something for everyone. Residents who are more wealthy are more likely to shop at Trader Joe's and Whole Foods than they are Publix, and they're also less likely to eat fast food. But people who are on the lower end of the income spectrum, they're going to be the ones shopping at that Publix or going to that fast food restaurant because it's more affordable. And they're also the ones who are more likely to go to the Grady main outpatient pharmacy because patients can get their medications for as low as $5. But however, they'll have to go through the hassle of trying to navigate through Atlanta traffic. And just an overview of the clinic, the North Fulton Health Center provides service to all patients who have insurance with the Grady Health System. And I couldn't really get a lot of pictures because this was a busy day and it had security, and he had 2 security guards on deck, so I really couldn't get as many pictures as I wanted. But they have 1 front desk, 2 receptionists, 6 patient rooms, 1 phlebotomy lab, and 2 security guards, because this is also a tax service building as well, so they need to have 2 security guards, 1 upstairs and 1 downstairs. They have primary care physicians that work in this clinic, and also staff manages many chronic illnesses, pain, and sexually transmitted infection. Most patients here are between the ages of 35 to 55 years old, and most of them are either African American or Latino. And these are some of Grady's partners. So Grady partners with the Morehouse School of Medicine and Emory Healthcare. This is where they recruit most of their doctors from. They also have their own health foundation where they raise money to raise awareness about certain diseases and to try to mediate those diseases with their funds. And they also have a partnership with Blue Cross Blue Shield of Georgia, which is the main insurance provider in the state. And access to care. So approximately 60% of Grady patients reside in Fulton County, and patients can visit any Grady clinic and get referred to the Grady Main Hospital and Pharmacy, which is in downtown Atlanta, which is right in the right in the heart of the city of Atlanta. I'm not sure if you see my cursor, but the Grady main outpatient hospital and pharmacy is right here. And also to the right, Apple Financial Assistance application, which is actually what I love because Grady makes sure they have plenty of these for their patients, just in case if they're unemployed or they don't make that much. And if they fill out this form, they're able to pay a copay of $20 or even get their medication for $5 in the city. So it's actually very convenient. And the city of Atlanta has actually adopted some policies to combat cardiovascular disease and reduce the number of STDs in the city. And so right now, colleges and universities are allowed to administer PrEP at their student health clinics. And this is actually very major because as college students, they have the natural urge to experiment. And they might get involved in some risky sexual behaviors, whether heterosexually or homosexually or whatever the case may be. And so colleges want to make sure that they don't fall victim to their circumstances. So they have PrEP to pretty much eradicate their chance, or almost eradicate the chance of catching HIV or AIDS at such a young age. And to the right, you can actually see the number of cases of HIV in the city of Atlanta is a little over 30,000, which is quite alarming considering that that's on par with some third world countries. And so they built this triangular plaque, if you would say, right in front of the Civil Rights Museum, just to make sure that people are aware that this is an issue and they need to start taking it seriously and start raising awareness about it. And the state also legalized cannabinoid oil for sale in Georgia nutrition stores in 2017. And this will help reduce a patient's pain if they have any sort of chest pain from the cardiovascular disease or whatever. Cannabis sativa is known to reduce pain over time. And so when the patient gets that from the nutrition store and ingests that into their system, that's going to relieve some of their pain. And thus to give an overall analysis of community health. And so as far as strengths, the clinic manages most chronic diseases and STIs. Patients have access to healthy food and pharmacies. There's parks and recreation. There's free screenings at health clinics. Low-income patients are able to receive health advice and assessments. And most employees at the clinic are multilingual, so they're very conscious of the language barrier, and they try to make sure that's not an issue. And as far as weaknesses, there are no Grady main outpatient pharmacies nearby, as I mentioned. The only location is in downtown. And the cost of living in Atlanta, especially in Sandy Springs, is rising exponentially. And so you have this huge income disparity between the rich and the poor as far as receiving care. And as far as opportunities are concerned, new housing is being built to accommodate for the increase in population. However, there's gentrification that's taking place and people are being priced out. And so they have this choice between either paying rent or they have to afford their medicine. And colleges and universities in Atlanta, are, like I mentioned before, are making PrEP more readily available to students. And despite all the good things that are happening, there are still some threats that are still prevalent in the city. Like, for instance, the average age in Fulton County is aging, and so they're going to have to go to the doctor more, which is also going to be costly over time. If they have to be admitted to the hospital, that's more money that has to come out of their pocket. And Fulton County still has some of the highest HIV, gonorrhea, and syphilis rates in the country. So if that goes left untreated, then we have a huge epidemic on our hands. But the recommendations I would make are to mandate sex education in schools starting in the 6th grade, so that kids as young as 11 or 12 start to become conscious of what about their health and what risky sexual behaviors are, and how to combat them over time. And the city should host more charitable events that will raise awareness of cardiovascular disease and STIs in the city. and allocate those proceeds to hospitals and clinics who service at-risk populations, because those at-risk populations really can't afford access to care, or they're not likely to see a doctor at all. But if clinics in these populations are invested in over time, then that scenario is going to change. People are going to be more likely to go to the doctor, and because they'll be able to afford the care over time. Few references, and that's it.